Hello everybody, Brent Agin here with Q&A with Dr. A. Sorry about last weekend. We did not have, it was several different things that did not allow us to have the Q&A. But anyway, today we are kind of extending through our Men's Health Month and going to talk a little bit about sexuality and specifically penile injections because it's a therapy that isn't well known, and I think the importance is very high. Just kind of extending out of Men's Health Month. I mean, this isn't trying to not help women with potentially sexual arousal disorder or any sexual dysfunction, or just trying to improve sexuality. That conversation is going to be the same. I will talk a lot about sexuality just because of how important it is in people's lives that they have, good relationships, really focus on experiences, quality relationships, and obviously sexuality is a big part of that, especially when you're in a relationship. They have a lot of research to show how sexuality and that type of bond and closeness and how it can equate to happiness and reduction in disease and just overall better well-being. And so you just have to, I mean, it's an amazing thing. Most people would say that they enjoy sex, and if they don't, they really wish that they could increase their awareness or their interest in sexuality. So let's just get a little bit into the importance and why people might start having sexual dysfunction. So, everything about TeleWellnessMD is about lifestyle. All the therapies we talk about, all the therapies that are offered on TeleWellnessMD, our practice is basically lifestyle medicine here in Clearwater. And so, we get a lot of people that come in and are having problems, either performance or wanting to increase the excitement, have better performance, or longer lasting sex, how to approach their loved one and or a partner into having more or increase or have more quality or quantity of sex. And there's a lot of reason for that. So sometimes it can start to cause problems in relationships when one person has one view on sex and the importance of it, and another one has a different view. And sometimes that starts to occur either after relationships have been people have been in relationships for a long time, or as we start aging, or if there's a change in health. I know that during the pandemic, there were people that kind of explained two sides of the coin. One group said they didn't have much to do, so they stayed around and had lots of sex and reconnected with their partners and really had a great relationship that came out of it. And then the other side, there were people saying, holy crap, get my partner out of my house. I was about to kill my spouse, and they actually kind of let go of their lifestyle and had less sex and more kind of a abrasiveness in the relationship. And that's unfortunate, because obviously this is a very important thing as we're going through these troubled times, is relationships. And that means not just with the person, our partners, but also just in general, just with friends, family, just good bonds. So when you do have someone that you can have a sexual relationship with, that sexual bond is important. And so what you kind of start seeing is that as we start aging, like I said, is whether relationships are becoming stagnant or it's just age-induced situation where there's some issues going on where sexual activities are being minimized, or they're becoming painful, they're even becoming incapable of having sexual intercourse. And these things can cause embarrassment, lack of confidence, and then obviously some disruption of the relationship in general. Because sometimes men or women are embarrassed if they're having problems, if it's painful, or if they're just not enjoying it. And of course, men, if they're having erectile dysfunction, that's a huge problem with confidence. They don't want to, and what the woman can take that as, they can say, well, maybe he's just not into me anymore, he's not interested, and then you can see that can bring about sadness and then probably further issues in the relationship. So just things that you just have to identify and keep an open communication, because you guys got to be able to communicate. Everyone needs to be able to say, hey, this is the problem, this is what's going on, because in a lot of cases you can't necessarily blame yourself for the situation, but there are things you can do to improve it. But you have to start with communication, so nobody feels that there's a reason, that they're the reason, or that there's something that they're doing that is creating this problem. And so let's just start with that. So like when we're talking about men and erectile dysfunction, you have to start with, again, looking at lifestyle, because it's very simple to think that penises basically have to have blood flow. The tissue of a penis is similar to a muscle. It's not a muscle; it's a spongy tissue that basically your nervous system gets excited, something turns you on, and then you get blood flow to the penis, and that basically engorges this spongy tissue, and then you have an erection. And so you just imagine that when we talk about anything in fitness or performance, whether it's the brain, the muscles, everything's about blood flow. And as you start to, you can even think about the heart. When you start getting plaques or some sort of blockages or obstructions or anything to cause the blood flow not to go to the heart, you're going to have some problem with the heart, including a heart attack, which then obviously makes the tissue either damaged or even dead, but definitely can affect the functionality of any tissue that does not get blood flow. And so as we age, or if you start not using your penis as much, you're going to see that problem can compound on itself. And so it still comes back to lifestyle. So immediately, if you're sitting there looking at your current situation today and saying, "Gal, my erections are just not as good as they used to be," think about, well, what are you doing about it? What are you doing to try to correct that? No difference if you started to realize you were putting on some belly fat, or you're starting to get man boobs, you're starting to not be able to sleep. Any problem that you're having, usually you're going to start thinking, okay, well, there's something I can do to correct it. So this is no different situation. When you start sitting there saying, okay, well, my erections just aren't as good, they're not as strong, I'm starting to not even be able to finish sex. Well, you should be immediately thinking, well, what can I do to improve that situation? And of course, if you've been working at it and working at it and working at it and you haven't gotten any change, that's when you obviously need to reach out to your doctor to get some help. But usually, they're going to tell you the same thing I'm telling you, which is, yes, there are some things you can do to help with erectile function, but most importantly is that there's things you can be doing in your lifestyle to increase the chances of getting back to having erectile function and having good intercourse without needing any sort of medication at all. And so that's going to be sleep, diet, and exercise. So the deeper stages of sleep you're in, the more exercise you do, and the better your diet and less body fat you have is going to keep your body in what we call homeostasis, or just complete balance. And when the body is in balance, things work. And that is where, that's why we call it functional medicine, is that we try to do things in our medicine to keep the body functioning the way it's supposed to, just physiology. And so it's very rare that you have someone that has, adequate sleep, adequate diet, adequate exercise, and is at their ideal body weight, and they're coming in saying, hey, I'm having some erectile dysfunction. Now, it does happen because, remember, it's not just physiological. So it's not just your anatomy and your physiology that's creating an erection. You also have to think it's your brain. And so one good comparison I use is that, erectile dysfunction is very similar to insomnia. And so what I mean by that is that when people start to have issues with sleep, they, start saying, "Gal, I just can't sleep. It's been going on for several days, several weeks, several months." After a while with insomnia, you start to realize that you're almost creating the insomnia just by the anxiety of not being able to sleep. So as you're going through the day, night starts to come in, and you're already getting worried about not being able to sleep. And so if you're already getting worried about not being able to sleep, you're going to trigger your sympathetic nervous system, and you're going to start spilling cortisol out, which is your fight or flight hormone, and you're going to start getting your heart rate going up, your body temperature going up. You're getting ready to fight or run, and you're really supposed to be going to sleep. And so now you can see how you're creating the own anxiety to cause you not to be able to sleep. The same is for erectile dysfunction. Men will describe erectile dysfunction as literally everything's going great, and they'll get one thought in their head about, maybe I'm going to lose my erection, or it's not going to last, and just like that, it just stops. And then once that happens, guess what? You start to mess with your confidence. Then every time before you have intercourse, you're going to start thinking, oh man, maybe this isn't going to work. Well, if you're already thinking it's not going to work, it's not going to work. So, you know, and this is people that have never had problems before, get into a new relationship, and all of a sudden they start to think, going, oh man, this is not going to work. And they talk themselves into a problem. And so herein lies the reason to talk about some of the solutions, but most importantly is just to also remember you have to think about your lifestyle. And so let's get into actually what we had this whole Q&A for, and that's penile injections. And so let's just think about a little over 50% of men have some form of erectile dysfunction. Usually it starts after the age of 45, but you know, we're having men in their 30s and 40s all the time now coming in having some issues with erectile function. And a lot of that, I think, is lifestyle, especially after the pandemic. Like I said, I think a lot of people increased their alcohol intake. A lot of people left the gym and have not got back into a regimen. So there's a lot of things that they can do to help improve their lifestyle. It's the same with stress. Stress can be a killer of sleep. It can be a killer of lifestyle, and really increase the chances of not having as adequate erections as you would like to. But as you start kind of thinking about, okay, what can I do to improve my sex, is try to look and feel the best you can, try to get your exercise in, try to get your deep stages of sleep, improve your diet, stop drinking alcohol, especially before sex and especially before sleep. You have to realize that alcohol directly affects your deep stages of sleep. And alcohol also is a huge cause of impotence or erectile dysfunction. So if you're automatically needing alcohol to improve your confidence or decrease your inhibition so you can actually court a woman for sex, you just have to start thinking about using something else, because alcohol is going to really decrease your chances of, and it's a diuretic as well, which means it's going to cause you to lose water, which is going to actually decrease your chances of getting that blood flow you want. So as you start to put a plan to get your lifestyle back in order, that is ultimately going to equate to better sex. The other thing to consider is hormones. So there is definitely a correlation between testosterone decline, or all hormone decline, including growth hormone, and age, and the chances of not having as powerful or sustainable erections, or even having complete erectile dysfunction. So, if your lifestyle is good, everything seems checked, your relationship's good, you're excited, you feel excited, but then you get in to have intercourse and the erection isn't there, that is either going to be psychological or is going to be something that could be hormonally or hormone induced. And so you definitely need to consider testosterone for those situations. But just remember is that there are plenty of men that have low testosterone and have very fine erections and no issues with sex at all. Erectile dysfunction and libido are lower on testosterone therapies benefits. Usually it's energy, sleep, mood, confidence. Then comes erectile function and libido as far as what men kind of get out of testosterone therapy. But it is a possibility that you could have some hormone decline. Another thing that can happen also with men is if you started on hormone therapy, sometimes some clinics will start you out on too high of a dose of testosterone. The first 3 months you feel amazing, erections are great, and then all of a sudden, bam, erectile dysfunction hits. And that's because of shutting off your own production of testosterone, and also could be increasing your prolactin levels, which actually shuts down your dopamine or reduces your dopamine secretion, which is what you need for pleasure and to be excited. So that's another thing just to think about. If you are on testosterone therapy and your erections got worse, just kind of look at what the dosing is, make sure you're not on too high of a dose. Another thing would be is to get on HCG or Kispeptin to keep your own testicular production of testosterone as high as possible as well. So while doing all these things and sorting through these things, let's get into some of the solutions. So most men choose to go right to some of the oral erectile meds, which are, Viagra, Cialis, Levitra, and these work okay. Probably about 30%, it's right around 40% of men do not respond to oral erectile meds. And the other problem is that almost no men, it's like around 5% of men actually even know about penile injections. And so, you have all these oral erectile meds, that people use, and it's almost always the first prescription that a doctor is going to prescribe you if you say you're having issues. They're not going to talk about lifestyle. They're not going to talk about how important that is. They're going to give you a medicine and say, I hope this works for you. And it does work for some. Some it works amazing for. Some the side effects are too high. It's reported that 15 to 20% of men will quit the meds just because of side effects, and the other, like I said, 40% quit because of it just doesn't work as well as they would want it to. So why use it? So that brings in penile injections. So penile injections are just what it says. It's an injection that you put into the shaft of the penis on one side, not both sides, and you do it, and within 5 to 10 minutes you should have an erection that lasts 30 minutes to 2 hours depending on the dose and your situation, and it really no side effects. I mean, if you do this the right way, the side effects are pretty much limited to irritation at the injection site, or the most severe side effect that you can get is priapism, which is just basically having an erection that lasts greater than 2 hours and becomes painful. And in those cases, sometimes it can actually become an emergency. If you have too much blood and become engorged, you would have to go to the emergency room. But again, I've been practicing for 20 years. I have some patients that have been on penile injections for 25 years and have never had to go to the emergency room, never have had a case of priapism, and that's because they're doing the injections the right way. Now, if you're a younger guy out there as well, just realize if you already are having erectile dysfunction at an early age, you also have to consider that this is a blood flow or circulation issues. It's sometimes, if it's not psychological. So sometimes that is actually shedding light to having some other blood flow or circulatory issues, including your heart and peripheral vascular circulation too. So just think, if you're someone young that's already having erectile dysfunction and need oral erectile meds, you might want to also get an early cardiovascular evaluation. So back on the penile injections. So these injections have low side effects. They're very effective, and they're not expensive. You can get a vial that gives about 10 injections for I think under $150. And considering the efficacy and the duration of time, it's definitely something to look into. I would say about I would think almost 100%. I don't know anybody offhand out of the clinic that I work at that has started penile injections and have reverted back to some other option. A very, very high success rate and reorder rate, because they're just happy with them. No side effects such as blurred or bluish color of vision, stuffy nose, and most importantly, headache. People can get headaches that feel like hangovers, and when you get those, you really are a little disappointed because it almost outweighs any effects you're going to get from erections. So penile injections are safe, and you just have to kind of get over this idea that sticking a little tiny diabetic needle into one side of the penis is that barbaric, because it's really a simple thing. And like I said, almost 100%, if not 100% of the patients that I have that have converted into penile injections have stayed on them. They're just extremely happy with it. They're happy with the results. They're happy with the ease of use. They're happy with the reduction of side effects. And that also means that there's really nobody that can't get an erection. So if you're out there and you've just kind of said, no, it doesn't work, the side effects on the oral meds are too much, I'm just not going to have sex anymore, then you should be listening to this, because you can have sex, and we already talked about how important having intercourse is. So just do not be scared to try these injections. One of the things that you have to also consider is, could this actually help increase your chances of improving your erectile function? And the point is, yes, it could. So some of the things that you can do to try to decrease your need of having penile injections is to just get them started. Because if you're someone that has a psychological problem, remember we talked about the people that really have a perfect lifestyle but get into a relationship and they find themselves nervous and already thinking about not performing, and that just consideration is what causes the erectile dysfunction. Well, sometimes you don't even need to actually inject your penis, but just having the penile injections at your house is enough comfort for you to know if you need it, you have it. And so I usually tell my patients to just get it, try it once, You can massage the area where you inject to make sure the medicine is in there, and massage it so it gets into the tissue. Some men will actually have to do a little bit of massaging to the penis. You can call it masturbation if you want, but either way, you're just trying to get some sort of activity going into the penis. And that also brings up about foreplay, which I'll talk about a little more in a minute here. But once you can kind of see how easy the injection is, what the result is, you can start working on what your dosing is going to be. But once you know it works, then if you're someone that has just the psychological component, but the anatomy works great, you can masturbate, you have no problems with blood flow, then you're going to be one of those people that just having it might be all you need. And just having that confidence of knowing, okay, well, if it doesn't work, I got a solution. Next thing you know, you're more confident and you're having erections without even needing the penile injection. Now that also brings up another point about dosing. So people will ask, does your dosing potentially go down as your lifestyle improves, or as you get more confident with your partner, or with foreplay? And the answer to that is yes again as well. So you might be using penile injections, and then you start losing weight, you start exercising more, you start getting better deep stages of sleep. Your dosage of the injection is likely going to go down to the point where you might not end up needing it in the future. So that is completely accurate. The more you work on yourself, the healthier you are, the better you're feeling, the more confident you'll be, and yes, you can start getting to the point where you don't need penile injections. So just remember, just because you start a penile injection, just like diabetes, just because you take insulin doesn't mean you can't also make lifestyle changes to try to get handle of your diabetes just through lifestyle means. It's the same thing with erectile dysfunction. Now about foreplay. So that's the same thing. So yes, you can inject using a penile injection and get an erection without any sort of foreplay or stimulation. But if you were to, like I said, you massage the area after the injections, give the penis a light massage, or if you have someone obviously that can do for foreplay, all of these things are going to increase the chances of having a great erection with a lower amount of the medication to inject. So just understand that if you know you're going to have a night where there's going to be a lot of foreplay, or a lot of stimulation, you might want to start at a lower dose than you have before, or just be prepared that the erection might last a little bit longer because of the stimulation you have. So again, just don't be afraid of these. If you get started, remember 100% of my clients that have changed over to penile injections stay on them just because of for the reasons I mentioned. So now let's talk a little bit about what happens with the penile injection. So they're very easy to use. You get them in a lyophilized vial, which is a kind of a frozen powder. You dilute it. That needs to stay refrigerated or cold. They only last about 6 months, and the efficacy can start dropping. You also have to be careful if you travel with it. You have to travel with it cold. And then people ask, sometimes can you inject and just not get an erection? The answer is yeah, and usually it is getting it into the wrong spot. I'm not going to go too deep into the ingredients and the way you inject, because all that's going to be available for you if you choose to get penile injections. But you're just going in at the 10 or between 9 and 10 and on 2 or 3. You inject with a diabetic needle and you inject your fluid. If you don't get an erection the first time, you have to wait 30 minutes to make sure you don't end up starting to get an erection, and then you put more medicine in, which again is going to increase your risk of having a painful and a longer erection than you desire. But very easy to store. Some people don't want to tell their partners that they're using these injections. I tell people, just be honest. It's one of those things that if you don't, if you have some reason that you need them, be honest with them, because it's going to make your erectile dysfunction, or I should make your erectile function that much better if you're being transparent. If it's something you don't want to disclose, all you have to do is say you got to run to the bathroom, and then you can obviously do the injection very quickly. And like I said, within 5 to 10 minutes, you have an erection that can last 30 minutes to 2 hours. Now, there's also 4 different types of penile injections. There's a bimix, trimix, quad mix, and super quad mix. So when people are starting out, of course, they're going to start out with either bimix or trimix. I usually start people that have a necessary or a need for penile injection therapy. I usually start at trimix, and you're only starting with about 5 units, which is it's 0.05 cc's, which you can see on this insulin syringe. You're talking that much fluid right there. See, beep, That's it. Then you can go all the way up to 30 to 50. You can still see that's not a lot of fluid, but usually once you get past 30 units of need on a trimix, I would switch you to a quad mix or a super quad, which is mostly just increasing the amount of the ingredients. And you can see bi, tri, quad, that means one has 2 ingredients, one has 3 ingredients, and one has 4 ingredients. And so some of them are just increasing the concentration or strength of the individual ingredients, and then some of them are adding on new medicines that are going to be inside that vial. So there's a lot of different options. You basically start with the lowest dose. There's a little bit of a project to figure out how much gives you the perfect erectile function, but after that, then hopefully you're working really hard on your lifestyle so where you can have this very predictable. So we talked a little bit more about side effects, and so there are antidotes too, so don't be scared. Again, you should try this because it is that important, and it just really helps with overall confidence. And as people start to have sex again, they do start paying attention to how they look and how they feel, and it kind of can ignite some people actually getting back into a good lifestyle and trying to be proud of how they look and feel. So this is really important. So the risk goes down when there's an antidote. So even talking about some of the side effects you can have, the risk go down when you can have an antidote. And the antidote comes with the injection, and that's going to be a thing called phenylephrine. Phenylephrine you can inject it, and you can repeat injecting it until the erection goes down. Obviously there's a certain amount that you have to there's a ceiling as far as how much you can inject to make this happen, and then otherwise, if you're still having a really painful engorged erection, you're going to have to go to the emergency room. But remember, this is such a rarity. I actually don't know of anyone that I've dealt with that have had to go to the emergency room for priapism. Now, the other antidote is Sudafed, and you can get that over the counter, and that is just a decongestant, and it'll tell you how to take these. Basically, you just chew up a 30 or 60 milligram Sudafed. Usually within 30 minutes, you start to see that the erection subsides a little bit. I also tell people to put ice packs on it, or see if you can have an orgasm, whether that's manually masturbating or having your partner get you to have an orgasm. When you have an orgasm, the erection usually goes down as well. So a lot of different things that can happen, but again, you shouldn't even really get to this point. Usually the times that people get priapism is because they are anticipating that they need more, or they don't wait the 30 minutes before re-injecting, or they take the injection on top of already taken Viagra or Cialis or something else. So these are all things that could actually self-induce this erection that won't go away. But if you just do things the way you're supposed to do, you should have great results, low side effects, and actually be having good intercourse. And so it's an amazing opportunity for me when I have male patients that come in and say that they haven't had sex in 2 years because they just gave up on it. Again, saying that the side effects of the oral meds were too much, and they just really believed that they just it wasn't worth it, and they just figured, oh, I'm getting too old. It doesn't matter if you're 65, 75, 85. If you're a man and wants to have erections and you don't have any sort of anatomical problem that could keep you from having them, this is a therapy that will work. You just have to work with your doctor and make sure you're doing things the right way, and make sure that your partner knows that you're getting back on the saddle again, because it will make you feel amazing to be able to have that bond again, and it just changes relationships. And so I always say there shouldn't be anyone that does not have intercourse. If you have a working penis and you want to have intercourse, there should be things that you can do to make that happen. So hopefully this all makes sense. I'm going to kind of put it back and recap this again, and just saying that sex is all about lifestyle. Everything you're going to come back to is, if you want good sex, if you want good brain function, if you want good sleep, if you want to look good and have good muscle mass, if you want to have low body fat, all of this comes down to sleep, diet, and exercise. Sometimes you add hormones in there too, but you know what? The better your lifestyle, the less your hormone needs are going to be as you age. But it's pretty simple. So I shouldn't say I don't like when people come in. It just doesn't make sense to me when people come in and they're 100 pounds overweight, they're not sleeping, they have no attention to their diet, they're not exercising at all, and they think that there's going to be a magic pill just to, that they can't understand why they aren't having great sex. I mean, it's got to start with why wanting to take your clothes off, wanting to see, have that engagement with people, and being proud and being confident. So, despite what your needs are going to be to get started, think about that in the back of your head. Start getting into a regimen and enhancing and making the changes in your lifestyle that would make sense to you, why you are expecting better function, but yet you're not doing the exact things that you would imagine or probably assume are the right things to do if you wanted that function to be there. So just, again, focus on lifestyle, but these are some tools or adjuvants to a healthy lifestyle to get you having good sex right away. And the better the sex, the better you feel, the more motivated you are. So just remember, if you start on penile injections, it doesn't mean you're going to have to be relying on them for the rest of your lives. That's not the case. They're very safe. You have all the tools and understanding on how to do this safely and correctly, and you could be having sex as soon as you can get your injections to your house. So if you guys have any questions, we have medical support at TeleWellnessMD. You can call and talk to our staff about any questions you have on these injections. So just, do not hesitate, do not wait, get started. This is very important. And I'm glad this kind of falls at the end of Men's Health Week, because it's sad that less than 10%, somewhere around 5% of people even know about penile injection therapy. But as I told you, 100% of my patients that switch to them stay on them, or they eventually get their lifestyle in place to where they don't need anything. So again, this is Q&A with Dr. A. We should be back with a good topic in 2 weeks from now. And you guys have a great week, or rest of your week, and have lots of sex. Thank you.